Thank you very much, and our thanks to Accenture for hosting this event this morning, and also the event we recently held in Manchester on the same theme. I think it's really important in a field like this to exchange good practice between businesses and between business and the public sector as we struggle with how best to ensure that our policies are bringing people back to the workplace effectively. And my thanks also go to Pfizer for their support, of course, a whole range of work done by the CBI in this field, and in particular the sponsorship for this year's survey, for which we're extremely grateful. So this is the easiest speaking gig of my year, because I didn't have to think about what I was going to say, because I get to stand up and basically present the survey. Now the survey is, it's like your favourite auntie in the CBI Employment Directorate, in the sense that it's always been around and part of our lives. We've been doing it for 25 years. But what we've been trying to do in the last few years is modernise it a little bit and look at some of the challenges that businesses face today. It is probably true that one could easily have landed the punch on the survey 10 or 15 years ago that it was about complaining about how lazy and work-shy employees were. I think British business has changed a lot in that time, and the survey now is a very focused attempt to try and draw some conclusions about what works and what does not work in a whole range of employee health arenas, looking both at presenteeism and absenteeism, but also at dealing with long-term illness and how to manage returns to work. So what does this year's survey tell us? Well, firstly, average absence in 2010 was about the same as in 2009. It was 6.4 in 2009, which suggests that the long-term trend that we see in the comparable data over the last 25 years has been maintained, that roughly absence has remained at the low levels we saw during the recession. And that's quite heartening, because you could easily have drawn the conclusion from the low figures in 2009 that people were coming to work because they were scared for their jobs. That doesn't seem to be the case, given that 2010 was a better than expected year in most businesses, and we've seen the progress maintained. The long-term trends that we saw we've seen over the last couple of decades have been maintained. People who do manual jobs are more likely to take time off, and larger organisations tend to have higher absence than smaller organisations. Again, also, absence tends to be higher in the public sector, but there's an important thing to note here, which is that this gap is actually the smallest that we've seen for some time. And there's clear evidence in the survey of progress being made in public sector organisations in managing short-term absence. Less so on the long-term side, and I'll say a little about that in a moment. And again, the purpose of the survey is to try and encourage best practice and learning between businesses, and it's clear that there is a great deal that can be done to improve performance. The gap between the best and worst performing firms widened again in the last year, and we're now seeing really quite substantial differences between the average of the top quartile and the average of the bottom quartile. All of this can be monetised, of course. £17 billion is roughly the economic output of the city of Glasgow. Don't ask me why I picked Glasgow. Clues in the voice. It's a lot of money. And a lot of it is unavoidable. And it's important for us as employers to acknowledge that. If people get sick, they should be off work. If they can't work, it's our job to bring them back when they're ready to work and in innovative ways. It is also our job to make sure that sickness is genuine, and we do measure the cost of false sickness absence at about 2.7 billion. Again, slightly up on the level of 2009. But that's a question of good quality absence management for short-term absences. Turning to why people are off absent, I think I kind of have the inclination to say duh, after non-work related illness and injuries are the most common causes of absence. Guess what? That's always been the case. What's interesting is when you cut that down, it's clear that there are strong trends to be managed in businesses. Back pain, in particular, is an issue, particularly in manual sectors. Musculoskeletal disorders of other forms, as well. Obviously, less common in non-manual roles where we see stress more apparent in the returns. Interestingly, the balance between long-term and short-term hasn't really changed very much over the years. It's about 1 in 3 days overall, but it's about half of days in the public sector. So coming down back to the comment I made a minute ago about the gap cutting in the public sector, what I think we're seeing is some of those strategies that public sector HR managers have put in place to absence manage beginning to work on the short-term side, but still a challenge in terms of bringing people back from long-term illness. So obviously, when we got this data, we asked companies about what they do, where are they seeking to get the progress that will help them manage absence better. We've seen most employees operating formal policies. Those that don't, this 5% at the top are typically the very small employers in the survey who don't require a written policy. Number of companies using absence targets, more common in the public sector than in the private sector though. But again, the strong long-term theme that actually getting to your line managers is what works. Conducting return to work interviews, placing responsibility for sickness reporting with the line manager, and supporting and training line managers in managing absence. So broadly speaking, we think that focus of investment is what lies behind the progress that we've seen over the last few years. And it's notable that the public sector is trying a number of different methods, probably a wider range of methods in the private sector in addressing these issues, and that may be a facet of some of the different job roles in the public sector. The real growth area, and where I hope we can focus the discussion this morning alongside rehabilitation, is fostering employee health and well-being. And what we saw in the survey this year is a really strong statement of support from employers for well-being being an HR priority. Lots of investment in stress management support, lots of thought about when and how to provide things like counselling, a real acknowledgement of the fact that we're seeing stress and mental health issues, both work-related and non-work-related, feature highly in the survey returns, and more willingness to beef up provision of occupational health advice in the future. Obviously, one balances that off against cost, and one of the key questions in the occupational health sphere for companies has always been who's paying for this. We are looking forward to engaging with David and his colleagues at the department on the Black and Frost review to see what sustainable policy outcomes we can deliver that help boost occupational health in both large and small firms. And I think in the SMEs, who provide a large chunk of employment in this country, that is a challenge for government as well as for those businesses. This is the bit that we led the press release on because it's the bit that the press liked. The footnote. We like the footnote. Every member I talk to likes the footnote in principle. They gave the survey last year got a really strong statement of support. This year, a bit disappointing, to be honest. Now, partially that might be because there isn't yet an e-footnote, so the footnote still looks like the old sick note in broad outline and is in lots of cases being used like the sick note. So less than a quarter of survey respondents found it useful, only 4 in 10 have used it to guide occupational health interventions, and 13% don't think GPs only 13% thought GPs had enough training to use it properly. Well, it's a long burn, the fit note. It'll take time. The e-fit note will help. People will get into the way of understanding its use. And I think we need to acknowledge it's a challenge for GPs and it's a challenge for employers. And there are cases around the country where fit notes are being used very well by GPs. There are cases where they're being used exactly like sick notes were. And likewise, there are employers who are using them very well and some who haven't yet come up with the right structure to react to what happens when the GP actually says something useful on the fit note. So from that point of view, this one is something that we want to watch through next year's survey in particular. The general feeling is that progress is beginning to be made, but very much disappointing by comparison to where we thought we might be this time last year. So overall, strong progress in terms of reducing absence. Still a significant cost. It always will be a significant cost. People will always get ill. But lots of evidence that good management can deliver better returns, and a strong sign of support from employers in supporting health and well-being, and looking forward to working with the government in the sickness review to make further progress building on the start we've made over the last few years. With that, I'd like to ask David to come up and share his thoughts with us.